Hi everyone. We hope that this presentation will be informative and also a bit of fun. So we are in the second year of our study for the Faith and Mental Health Project. We have finished our fieldwork and we are currently looking at analysing all the data we collected. We spoke to almost 40 individuals in the field of mental health and specifically related to Muslim mental health. So the three objectives in our study, which I should have worn my glasses for, are to understand faith, interfaith and mental health, to help bridge Muslim communities and mental health services, and to encourage religious and mental health literacy. And for today's presentation we'll be speaking on the middle one that's lovely highlighted for you.
Cool. So since we'll be talking about collaboration, this is Wally. He is our collaborator and kind of unofficial project mascot, and he's obviously wearing a witch's hat because it's Halloween. So we wanted to talk a little bit about Muslim communities and whether they are really hard to reach or are they just hardly reached. And that brings me on to our first case study, which is a case study of a local Mind charity who collaborated with another local Muslim mental health charity in Peterborough. So the Mind charity has a supporting mom service during the perinatal period, and they really noticed over the 7 years that they had been running that they didn't have any Muslim mums attending. They had something like 7 in 7 years, and that really didn't reflect the population where they were operating in Peterborough. So they reached out to this Muslim organisation called the Lantern Initiative, who they had heard about through other people, and heard that they had good standing in the community. They were talking about mental health awareness and they had good connections. And during that time they led a co-design service which they used, they recruited co-designers from the Muslim community, trained them up in a little bit of ethnographic research to go and talk to their friends in the community and in their areas to really learn what Muslim women needed during the perinatal period. And because of that, they then co-designed this new service which was specifically focused on Muslim mums' needs, and that has been now evaluated, which we went to their evaluation event last month.
Yes.
And they've had a really successful service. They've had a lot of engagement. You can see some of the stats on the presentation there. So a lot of the mums are now more comfortable going to any kind of mental health service or even talking about mental health. So this has been a really good example of how collaboration can work and what the benefits of it are. And there's me again. Back to Jamilla.
That's all right. So Muslim organisations have often filled gaps that mainstream mental health provisions don't necessarily address. So throughout our project we've seen that many practitioners have noticed a lack of religious literacy amongst the profession. So that leads many Muslims to be perhaps not getting enough out of the treatment when they seek mental health support. So what we've looked at some examples of is an asset-based approach, so looking at what's already there in the community, and then statutory mental health organisations or mainstream organisations can collaborate with those existing services. So our second case study is of a mosque in Birmingham who did some great work, especially around, I feel like some people in the audience know which mosque this is, did some great work, especially during COVID with mental health. So they set up a helpline called Here For You. They have a mental health project called Is Anyone There? They've ensured that their imams and their staff are trained in mental health issues. They have a domestic violence service with domestic violence IDVAs and support workers. And they've also collaborated with not only their local NHS but statutory organisations like Macmillan Cancer Support, who have come into the mosque and they offer a holistic service for those suffering with cancer. So they look at their mental health, they look at their spiritual well-being and anything they can do to help. And they've had some really great outcomes by statutory and mainstream organisations going into the community where the work is existing and supporting the existing projects rather than trying to reinvent the wheel, so to speak. So one thing we came across during our research was something called integrated care systems, or ICSs, and they came into play about a year ago, and they replaced what was known as clinical commissioning groups, or CCGs, which were basically the part of the NHS in different local areas which commissioned services. So they would commission, for example, domestic abuse services or mental health services. And we found in our research that a lot of organisations that were doing great mental health work, specifically around faith and mental health and Muslim mental health, weren't aware of ICSs because either the ICSs hadn't reached out, or it was just something that, you know, they didn't know how to approach them. They didn't know how to apply for tenders, for example, when services were being put out for tender. So we're hoping that through this project we can provide recommendations for ICSs to encourage them to, what's the word I'm looking for? It's late, forgive me. Encourage them to reach out to these existing projects and work with them. And we really want to ensure that good practice is shared, and that's why we focused on those 2 case studies, because we're hoping that, so for the first case study, other Mind organisations throughout the UK can learn from that, and also with the example of the mosque in Birmingham, you know, other mosques can adopt some of those practices, although it might not all be realistic, but there's definitely, you know, some bits that could be taken on board.
This is going to look like a very nice picture, so just stick with it. So what we've kind of concluded so far, because we're in very early stages of analysis, is that our respondents have called for a ground-up approach. So this is the grassroots level, as you can see the grass. And what really needs to happen is really strong partnerships that are collaborative between NHS and mainstream health services, that could be privately funded as well, with Muslim-led organisations like the examples that we've shared, so that we can get religious and cultural literacy, so Muslims can access services and not have to become teachers for therapists. We can have knowledge exchange between NHS services and Muslim communities to increase mental health knowledge in those communities, continue removing those stigmas and those taboos, but also have knowledge exchange where Muslim experts are consulted about what Muslim communities need so that they can be provided for, and then hopefully in the end have increased access to more suitable services for Muslim communities. Thank you.